Welcome to Accelerate My Practice. So glad you could join me here today. I want to talk today about the rivalry between Burger King and McDonald's. And you might be sitting there thinking to yourself, what does this have to do with dentistry? And I think it has a lot to do with dentistry. And the reason why I think that is because if you look in Fortune magazine, as you see on this graphic below, it is the number 11th greatest business rivalry in history. Goes way back, and some of the history is interesting. McDonald's was founded in 1948, Burger King was in 1954. And so it's fun to see how this rivalry went on for a long time. And what was interesting to me when I look at it is you get all the way to about 1970 and McDonald's seems to be owning the market. And back then McDonald's was kind of like Henry Ford was, which was you can have any color as long as it's black. McDonald's was the same way. You can have whatever burger you want, but it's going to come with 3 pickles on it, ketchup, mustard, lettuce, whatever it is, and sorry, we can't customize it. You have to pull it all off. And then in 1973, Burger King launches this Have It Your Way commercial, which completely disrupted McDonald's whole business plan because people got so accustomed to having no choices that it was just this way, this way, this way. And regardless of what they thought of it or liked it or didn't like it, it all of a sudden Burger King comes out with you can have it your way. What was interesting to see is how Burger King in 1973 grabbed massive market share from McDonald's. Now, how does this parallel apply to dentistry? Very simply. What do you think corporate dentistry is? What do you think they stand for? Because in my mind, when I look at corporate dentistry, I see McDonald's systematize everything. You can have it your way as long as it's our way. You can have any color car you want as long as it's black. And that's kind of the way I see corporate dentistry, at least as an outsider. And you know, in all fairness, I've not been inside. We don't have corporate dental clients, so it could be very different for all I know. But my experience as an outsider looking at it or talking to people who have been in corporate dentistry is that that's kind of how it goes. You know, we have this set. It goes this way, this way, this way, this way. And what's interesting to me is as I look at that, some of that, of course, you know, McDonald's, as an example, has systematized everything in order to take out any ability to have to think. And the reason why they've done this is because they hired, you know, $6, $8, whatever minimum wage employees are, who don't have the ability, the critical thinking skills to make good decisions on their own. And to me, if I were in corporate dentistry, I'd be a little bit offended because to me, it kind of looks like corporate dentistry is doing the same thing because they view some of the people in corporate dentistry, the employees, as not able to make good decisions. Now, that being said, I'm not digging on anybody for sure. And if anything, I think that lots of people do have the ability to make good decisions. They just need to be educated on how to and when to and all those sorts of criteria. And of course, from a business perspective, we should systematize some things to create consistency. But I do believe that the difference between corporate dentistry and private is that ability to have it your way. So my question is, in your dental office, do we treat the patients in a fashion that they can have it their way? And not their treatment, because obviously we want to give them choices and such as that. And we don't want to put ourselves in terms of liability at risk by saying, hey, you know, I'll whiten your teeth and I'll put some crowns on, but I'm not going to treat your perio because you don't want to, because those are areas that we can't. Those put licenses at risk. But in terms of our interaction with our patients, we have a great ability to customize how we work and what we do with our patients. And therein, I think, is where the difference lies. The delivery method is just slightly different. And that's what I'm suggesting here is you're still going to do dentistry for your patients. You're still going to offer your best dentistry for patients, and you're going to do it in a clinical setting that doesn't put your business and your license at risk, but you're going to do it in a fashion that gives the patient empowerment. Because really that's what I'm talking about here is how can we empower the patient to be a part of the decision and to own the decision. And going back to your dental practice, how can you serve and service the patient better? So can we offer them the ability to schedule appointments on the web? Can we offer them the ability to pay their bill on the web? But do you offer that convenience to your patients? If you don't, you should look into it because that's how they think. I mean, in a perfect world, they pay the bill before they leave. But if they get out and they have a bill, if we can give them the convenience to do it on their terms, not have to go get a stamp and an envelope because nobody has those things anymore, and just pay it right there on their phone while they're riding a train, a plane, a bus, an automobile, whatever it is they do, now we're servicing our patients better. We're understanding how they want to be serviced. And I think if we do that, we'll see massive increases in acceptance in all areas of the business. So similarly, can they schedule online? Can they interact with you through social media? Can they know who you are through social media? I mean, your patients have lots of choices these days. I hear everywhere I go that there's more dentists in my town than anywhere else. Whether that's real or not, I have no idea, but that's what I hear all the time. And so if your patients have more choices than anywhere else in any other city, then you had better be on the cutting edge and servicing your patients in a way that brings massive amounts of loyalty to you and to your practice. And if it doesn't, you have a challenge there. And that's something we just need to address. And just improve it to where it matches. And I think if you do, you'll see massive improvements. So that being said, I think I beat this horse enough of going through your practice with a fine-tooth comb, making sure that it all does match. But I would go through and kind of inventory, kind of like you should inventory your life periodically. I would inventory your business periodically and make sure that those two things match. Make sure we're still headed the direction we want to be heading versus we accidentally wandered all the way over here and lost our vision as to what it was we were trying to do. I think we did a show a month or so ago about what business are you really in and what business should you be in. And those are good questions to ask yourself once or twice a year to understand, are we achieving the stated goals of the business, or do we need to change the stated goals of the business? And if we are achieving them and we're doing the right thing and we're living the life we want to live, I think what you'll see is much, much better results in terms of being congruent and the patients enjoying the experience. And I have no doubt in my mind, if the patients are enjoying the experience, with that comes increased revenue and profitability. So that being said, can't wait to see you next week. Until then, have a wonderful week. We'll be back here 8 o'clock Mountain, 10 o'clock on the East Coast. Until then, have a wonderful day. What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.